Hello friends, welcome to this session. In this session, we are going to learn about antianginal drugs. The learning objective for this session to know the definition, symptom, causes, and types of the angina, different risk factors and complications, diagnosis and treatment strategies, as well as to study the different classification of drugs, mechanism of drugs, structural activity relationship, uses, and their adverse effects. So first of all, what is angina? So angina is a strangling feeling in the chest. Angina pectoris is a chest pain that can be caused by the restricted blood flow in the arteries that supply to the heart. So, many a time there may be a coronary artery diseases which can lead to this angina. So, blockage develop in these arteries that also lead to the angina. So, very first of all, the symptoms of angina pectoris. There is uh, a severe chest pain or a discomfort, stabling, pulsating occurs into the left side. Pain in your arms, necks, jaw, shoulders, or back. Nausea and fatigue are common. Shortness of breath, anxiety, sweating, and dizziness to be observed. So let's see the causes of the angina. There are a number of causes for angina pectoris. The heart needs to be supplied the blood or oxygen. If there is a lack of blood with the oxygens, then it will lead to the ischemia, and this ischemic condition is also responsible for this less working of these cardiac muscles. Reduced blood flow to the heart muscles, coronary heart diseases. These are the majority of causes for this angina. There are some other causes for angina pectoris that includes narrowing of the aortic heart walls, anemia, abnormal heart rhythms, diseases of heart muscles. These are all the causes for angina pectoris. Now let's see the different types of the angina pectoris. There are n number of types of the angina pectoris. Three major types, that is typical, stable angina, second unstable angina, and third one is a variant, or it is also known as a principal angina. So the typical or stable type of angina, there is a decreased coronary flow, occurs on physical exertions, and this lasts for 5 to 5 minutes or less. While unstable angina, there is a epicardial coronary spasm and formation on non-occlusive thrombi that can be the causes for this unstable angina. Can occur at the rest heart attack, and this is the emergency attack. This is the majority of cause. While the variant or principal type of angina, this observes only in up to the 2% patients. There is a reversible coronary spasm occurs at the rest. Now, look at the different risk factors of this angina pectoris. Tobacco use, diabetes, high blood pressure, overweight, high blood cholesterol or triglyceride levels, personal or family history of heart diseases, older age men older than 45 and women older than the 55 have a greater risk than the younger adults. There is a lack of exercise, obesity, stress. These are the major causes for angina pectoris. Now let us see the different complications which arises during this angina pectoris. There is a pressure, fullness or squeezing pain in the center of your chest that lasts for the more than 1 minute, more than few minutes, or the pain extending beyond your chest to your shoulder or left arm, backside, or even your teeth and jaw. So are the symptoms or complications arises. Increasing episodes of the chest pains. There is a prolonged pain in the upper abdomen, shortness of breath, and fainting occurs in front of the eyes. So these are the complications that arises. Now, how we will diagnose the anginal attack? So there is a physical examination can be done. There is a patient should be asked for the symptoms and family history of heart diseases. ECG is to be performed. Stress tests, X-ray, chest X-rays. These are to be performed for the diagnosis purpose of this anginal attack. So let's see the treatment strategy for angina pectoris. The main goal is to restore the balance between the oxygen demand and supply. So what we can do? We can change or modify the lifestyle. We can also use the antianginal drugs, and sometimes there is a necessary of the surgery like angioplasty, coronary artery bypass, grafting. So these are the treatment strategies for the anginal attack. So what should be the lifestyle changes we can do? So that can be a prevention. That is, a prevention is better than a cure. So we can stop the smoking, avoid exposure to the second-hand smoke. If there is overweight or obesity is in the patients, we can do the exercise and do the weight loss. We can use a safe exercise plan, avoiding stress, avoid the large meals and healthy diets. Aerobic exercise builds endurance by keeping the heart pumping for an extended period of time. So we can follow these lifestyle changes so that prevention can be uh, major for this anginal attack. So let's see the anti-anginal drugs. So what is anti-anginal drugs? These are the medicinal agents or the drugs which are used to treat angina pectoris, which is a myocardial disease. Now let's see the classification of the anti-anginal drugs. Mainly, this classification of anti-anginal drugs can be done in the three major classes: organic nitrates, or they are also known as the vasodilators. Second, calcium channel blockers, and third one is the beta blockers. So organic nitrates, these are mainly includes nitroglycerin, trinitrate tablets, glyceryl trinitrate tablets. The calcium channel blocker, these are further classified as a dihydropyridines, example nifedipine, benzothiazepine, these are examples are diltiazems, and phenylalkylamines, that is verapamil. Now, beta blockers are further classified as a two types, that is non-selective beta blockers and beta selective blockers. Non-selective beta blockers includes example propanolol. Beta selective blockers includes atenolol. Now let's see the first of all organic nitrates. So what is organic nitrate? These are the first line drugs. They are effective in stable, unstable and variant type of angina. These are simple nitrous and nitric acid esters of alcohols. They are used in the both treatment as well as prophylaxis purpose in anginal attacks. What is the mechanism of action of these organic nitrates? Organic nitrates interact with the tissue's thiols and releases nitrous oxides, which stimulates guanyl cycles, which increases the intracellular concentration of cyclic GMP and which lead to the vasodilations in large veins, resulting in pooling of the blood in the veins and decreased venous return to the heart, so which lead to the decreased preload towards hearts. Also, they dilate the arteries, resulting in the decreases in the resistance of the peripheral tissues, which means a decrease after load, and that results in the general decrease in the cardiac bursts. So, so the major mechanism of action of these organic nitrates to decrease the cardiac work by decreasing the this preload, that is a load on the heart and load from the extensive tissue, that is peripheral tissues. So example of organic nitrates. So nitroglycerin and glyceryl trinitrates. So look at the structure. So this is a glycerol with the trinitrate. that is called as a glyceryl trinitrate. So it has been used to treat angina and heart failure since last 1870. It can be prepared as a rapid acting preparation or as sublingual tablets or spray of glyceryl trinitrate for the treatment of acute attacks, or can be used long acting preparation like sustained release preparations, transdermal patches, and buccal tablets, and ointment of glyceryl trinitrates. If the first dose does not work, a second dose can be taken after 5 minutes and a third dose after further 5 minutes. If no effect seems to appear after the third dose, the patient must be hospitalized. For prevention therapy, one dose of glyceryl trinitrate usually eases the pain within the 2-3 minutes. So, next lecture we will see the calcium channel blockers. Thank you.